Lupus is a serious autoimmune disease that can attack any organ in your body, from your skin and joints to your kidneys, lungs, heart, or even your brain. It's known as one of the greatest mimickers in medicine because its symptoms can look like many other conditions, making early diagnosis challenging. Catching lupus early can prevent permanent organ damage and dramatically improve quality of life, which is why understanding its warning signs is crucial. Today, we're talking about the 5 early warning signs of lupus that you should never ignore. Lupus causes your immune system to attack healthy tissues, leading to widespread inflammation that can cause irreversible damage if left untreated. Early diagnosis and treatment can put lupus into remission and protect your health long-term, making education about symptoms vital. One of the most common early signs is joint pain, swelling, and stiffness, especially in the morning. If you wake up feeling stiff for 30 minutes or longer, and your joints feel better after you start moving, pay attention. This pattern is classic in inflammatory arthritis, and lupus is a major cause, so don't brush it off. Early lab tests like ANA can help confirm or rule out lupus when joint symptoms appear. Lupus makes many people extremely sensitive to sunlight, a condition called photosensitivity. Some patients get red, burned, or develop a rash after just 5 to 10 minutes in the sun. The most famous lupus rash is the malar or butterfly rash, a red or purplish rash across the cheeks and bridge of the nose. If you have a persistent rash that doesn't go away with usual treatments, see a dermatologist, as skin changes can be early signs. Unexplained recurring fevers, especially when infections and cancer have been ruled out, can be an early clue to lupus. In medicine, we call this fever of unknown origin, and lupus is a common autoimmune cause of recurring low-grade or higher fevers. If you've had repeated fevers with negative infection workups, ask about autoimmune testing, including ANA and double-stranded DNA. Hair loss is another common early sign of lupus, which can be diffuse thinning or in patches. In some cases, it's scarring, meaning hair doesn't grow back in affected areas. If you're experiencing ongoing hair loss that your primary doctor can't explain, see a dermatologist or a rheumatologist. Chronic, overwhelming fatigue is one of the earliest and most common symptoms of lupus. It's not just being tired, it's deep exhaustion that doesn't improve with rest. Because lupus causes systemic inflammation, fatigue often shows up early, sometimes long before other symptoms become obvious. If fatigue persists despite addressing other causes, and especially if combined with any of the other signs, don't ignore it. Now let's discuss 2 bonus red flags you should never ignore. First, protein in your urine can signal lupus affecting the kidneys, known as lupus nephritis. Ask for a urine protein to creatinine ratio. Levels above 500 are especially concerning. Second, unexplained shortness of breath could mean lupus is causing inflammation and scarring in the lungs. If you're having trouble breathing, even at rest, get it checked urgently. Lupus doesn't have to be a mystery. By knowing these early warning signs, joint pain, sun sensitivity, unexplained fevers, hair loss, and extreme fatigue, you can advocate for yourself and get tested sooner. Early treatment saves organs and saves lives. If this video helped you or someone you know, please hit the like button, subscribe for more health education, and share it with anyone who needs to see it. Take care of yourself. Early awareness is everything.